Support for the podcast comes from Behavioral Wellness for Women. As a dedicated psychiatric nurse practitioner, Brianna Dawson specializes in guiding individuals through the intricate journey of perinatal mental health and more. Embracing the challenges that accompany pregnancy and the postpartum period, she offers empathetic care and evidence-based solutions tailored to your individual needs. She offers virtual psychiatric evaluation and medication management for Pennsylvania and New Jersey residents, and is now in network with several insurances in Pennsylvania. Her areas of specialty include general psychiatry, perinatal and postpartum mood disorders, postpartum depression, postpartum anxiety, premenstrual dysphoric disorder, perinatal OCD, and medication management during pregnancy and breastfeeding. Every journey is distinct. Brianna collaborates closely with each client, creating a customized roadmap to emotional resilience and balance. Beyond treatment, she empowers clients with resources and coping strategies, fostering a sense of control and confidence in their mental health. For more information, visit behavioralwellnessforwomen.com. Hello and welcome to Parenting Stuff I Wish I Knew Sooner and Want You to Know Now. I'm your host, Erica Desper, founder of the Center for Confident Parenting and a mom who seems to learn everything I needed to know and still need to know the hardest way. I'm on a mission to help you avoid the same. My guest today is Michelle Litwer, a licensed clinical psychologist specializing in maternal mental health. She's also mom to two kiddos, ages 4.5 months and 3 years old. Congratulations on your growing family. And Michelle, thank you for joining me.
Yes, so good to be here, Erica, and to see you again in this capacity.
Yeah, so I'm excited to chat today because I wanted to dig into a postpartum issue that I feel like gets too little attention. Most of us probably at this point are aware of the baby blues, which, don't necessarily need to be treated. They're kind of going to go away on their own. And then separately, there's postpartum depression, which is very, very common and treatable. Hopefully, we've done a lot to reduce the stigma of that. But what I want to talk about today is another version of that. So the anxiety, the anger, and the compulsive thoughts that a lot of women in the perinatal period experience. How common is it that someone would experience any or all of those things?
Yes.
Because there's still a little bit of like, maybe something's wrong with me.
Yes, absolutely. So I think, postpartum depression is like historically what people think about when they think of any issues, with maternal mental health in the perinatal period, postpartum period. But now they really call it perinatal mood and anxiety disorders because there's so many things to account for. So what are mood and anxiety disorders? So of course it's postpartum depression, postpartum or perinatal, I should say, anxiety, perinatal postpartum OCD. And what I mean by perinatal is any time period from conception to like the first year after birth. And so
that might be surprising for people. They don't necessarily experience it, or maybe just no one picks up on it right away up to 1 year.
Exactly. And some people think, okay, it's postpartum. That means it's just after, I've given labor and I have this baby in my hands, but it really can start from the minute you are pregnant and way before. I mean, there's fertility challenges, there's loss, there's all of those things. But what's not talked about as much is anxiety disorders and OCD and trauma disorders, which encompasses, perinatal mood and anxiety disorders. There's so many statistics. There's so many, different studies. So I would say the thing that helps me the most, and I think it's easier for everyone to understand, is like 1 in 5 to 7 women experience postpartum anxiety or depression or OCD or trauma. Like that's kind of an easy way to look at it. And then 1 in 10 dads can experience postpartum depression. Depression is mostly, talked about with dads, but depression could look like anger with dads. A lot of times it looks very different. Dads or fathers could experience higher anger, aggression, higher substance use rates, maybe escaping with like watching video games, just being
that
less.
May be a cultural thing of like, that's what's more appropriate for them to access and exhibit in our culture. That might not be what they're actually feeling.
Exactly. And we can talk about, because I know you mentioned anger, and I guess this is just a plug for that, is anger is sometimes a secondary emotion. Sorry, you cut out a little, so I didn't know if I should pause. But it's a secondary emotion, meaning that sometimes deep down underneath the surface, there's actually other emotions that are going on. So anger is kind of like on the surface. I like to think of it like an iceberg. Most of the iceberg is above the water, and that's anger. And what's really deep down underneath that iceberg, like inside the water, could be other emotions like sadness, shame, guilt, disgust, things like that. So
And
it's
if
kind of
that's hard for
complicated.
someone to understand, I would think of a time when your kid like almost ran out in the street and you grab it and you're like, "What are you doing?" You're like,
Totally. And you're
it's like you're
so
angry, but really you got really scared, and then what came out was, this angry reaction. So that's, I know it's hard to understand secondary emotions sometimes, but that's what that is. I
exactly.
personally didn't experience the angry. Was one of my colleagues that brought that to my attention. She said she
Yep.
experienced that, and it was like, oh, well, how did I get
Yeah.
this far doing what I do? And I didn't realize that this could look like an anger thing.
Yes.
Um,
Yes.
so I
That's a
figure
great
other
example to bring
people
to
might
light,
need to know
by the
that
way.
too. Oh, good. Came off
Yeah,
the
yeah,
top of my
it was
head.
great. It's just you're angry, you're panicking, you're freaking out, but really
Yep.
deep down, you're so scared. And you would be so sad if anything ever happened and there would be, a problem. So
Right. Exactly. Okay,
yeah.
good. And then this may be just like it's so variable, but is there a breakdown with respect to how often it manifests as maybe a sad, more of a sad depression versus an anxiety versus an anger,
Mhm.
or is it just the 1 in 5 to 7? It's going to be something like that.
Yep. I think that it's easier to kind of digest the 1 in 5 to 7 people experience, like, a diagnosable mental health condition like
Right.
anxiety or depression. But because anxiety is much more looked at now and it hasn't been historically, they're noticing that like anywhere from 5 to 16% of women experience anxiety disorders
Mhm.
throughout the perinatal period. So I think that they're learning that more and more people experience something on the anxiety disorder spectrum. So with more research and more knowledge, I think we're actually noticing anxiety coming up more. And, another question that we'll talk about soon is just what does it actually look like, depression versus
Yeah.
anxiety? And actually some of the depressive symptoms look a lot like anxiety. So we can talk about
Okay.
that. It's not
Yeah.
as necessarily like the typical depression where people might think anxiety and depression kind of overlap a lot when it comes
Right.
to, the perinatal period.
Sure. Okay. And then so let's go to that next. What does
Yeah.
this feel like or look like for, the person experiencing it? And I think we should point out, just to kind of do this question together, sometimes the
Yeah.
person experiencing it is not going to be the one who knows that there's an issue and maybe support is needed. It might be, the partner, a friend, a family member. So what does it look like from everyone's point of view? And actually, before you do that, what does it not look like? So I mentioned that baby blues is different.
Yes.
So what makes baby blues different? We don't need to really like worry or seek treatment.
Yeah. So just a little bit about that. So the baby blues technically kind of last like from, labor, birth for up to 2 weeks, and 80% of people can experience that. So that's a lot of people. And I would say it would be crazy to not have anything happen in the first 2 weeks.
Because
And
it's
when it
just a
comes to
huge change in your life. You're exhausted, all the feels, and then the hormones. So like we're probably gonna experience something. That's not necessarily what we're talking about today.
exactly. And so you're tearful, you're tired, maybe you're not connecting with the baby, you're kind of like withdrawn a little bit, but those are all normal experiences. And if they kind of resolve in 2 weeks, then we're just talking about postpartum baby blues.
Mm-hmm.
However, if they persist, and I always like to think about like frequency, duration, and severity. So if like
Yeah.
every day you're feeling those symptoms, if you feel like they're lasting all day and you feel like they're pretty intense, like, and then we can talk about symptoms. Let's say it's really affecting your eating, your sleep, which that's tough because with a newborn, you're not sleeping so much in the beginning, but you're even when the baby's sleeping or the baby's sleeping at night, you're not sleeping too. If there's like excessive guilt, I think, as moms, we want to be the best mom and super mom. And so feeling a lot of guilt over not like being there for your child every minute of every day, feeling like you're losing control, withdrawing from the people you love, feeling like you might lose your temper, which is part of that postpartum rage and anger, general feelings of like feeling like a failure, having the thought like I'm such a bad mom, I'm such a bad parent, I can't do anything right. This was such a bad idea. Not wanting to get out of bed. So some of the more classic, symptoms of depression, not wanting to get out of bed, not feeling connected to the things that you usually love and do. You might be on the phone or taking a walk and you feel like I'm not even enjoying this. Or I'm talking to a friend, or this is kind of awful, or I feel hopeless, or maybe I'm not having such a great experience with my partner. We're not connecting. Just feeling like, what's the point of today? Which can, of course, lead to suicidal thoughts, which is something that's really important to kind of talk about too. A lot of people experience suicidal thoughts in this period of time, and it's less spoken about. There's shame about it, but it's normal to experience suicidal thoughts. There's a whole spectrum of them, but that's something to think about too, especially like lack of sleep, insomnia. All of that could be really, really difficult. And then with postpartum anxiety, there's a lot more like worry thoughts. So you might be thinking about things a lot, like what if my kid, didn't have enough food, or what if they don't wake up in the middle of the night because they stop breathing? Again, the obsessive thoughts, the worry thoughts. You might be also engaging in behaviors obsessively over and over again, which we'll talk about with postpartum OCD. It could be reassurance seeking. You're, on the internet saying like, are they sleeping enough? And Googling 3 times, what's the best thing that you can give to your kid right now, or reaching out to medical providers often. The anxiety kind of manifests in needing reassurance, needing certainty. And then there's all the physical symptoms of anxiety: heart palpitations, difficulty breathing, chest discomfort, panicking, sweating, not being able to focus, not being able to attend to things, not being present, reaching out for, resources constantly because, you really want to know everything. And then with OCD, there's plenty of obsessions that we can talk about later on, but there's harming obsessions, sexual obsessions, which if you've never heard of any of this might be like, what? But I will get into that further.
It's a whole,
And then
whole rabbit hole.
yes, exactly. And then there's things like post-traumatic stress, which also isn't talked about as much, whether that's during your pregnancy or during labor, whether that's, how the labor went or how you were treated at the hospital, what it was like to be, pregnant and all of that. So there's tons of different things that we're talking about here.
Yeah, exactly. And I'm going to throw out a lot of questions I didn't prep before. I apologize.
No, that's great.
That just made me think, like, obviously there are traumatic birth experiences. We aren't sure how it's going to go. Maybe the baby or the mother's at risk. But I believe it's true that if your baby goes straight to the NICU, there's you're at greater risk for a lot of this because that's such an overwhelming process.
Totally. It's something you're not prepared for. It's unexpected. You're, of course, recovering. Exactly. It's like, how could you not experience, so much stress during that time? Yeah.
So I don't want to get ahead of ourselves. Save this if you're planning on doing it later. But I wanted to go back to something you said that I think is really important, that it's about the frequency, the intensity, the severity, because I could hear a mom or dad or someone saying like, okay, well, like my partner is constantly checking the baby monitor to make sure the baby's breathing, right? Like that's a gray area of like, if you're a first time parent, there's no way you're not going to do some of that, right? So with the parents I work with, and obviously I don't wear the professional hat that you do, and I try to stay in my lane, but I say, well, let's think about it. Is this like something that you do occasionally for reassurance? You move on, you can then go do other things because you got that reassurance, or does it feel like a fixation, something you can't pull away from, and then other tasks are starting to kind of get, so is that what we're talking about, of like, there is a normal degree of this, and then there is we might need some help here kind of degree?
Totally. I think sometimes we have that gut feeling, like I've checked too many times. I haven't done any other things. I haven't done my laundry. I'm staring at my monitor. It's affecting my relationships. I haven't made myself a meal. It feels like there's this urge that I need to give into. And if I don't give into that urge, something bad will happen, or my baby will definitely not wake up. Or, like even in the OCD definition, it takes this ritual of checking takes up more than an hour of your day. And I hate to be like so stuck to anything. Like if it was an hour and 10 minutes, but that's just to think about.
Stop at 59 minutes, everyone. No, I'm kidding.
Exactly. No, I mean, listen. So I hate to be so rigid with that, but I think it's like, how is it affecting my everyday life? How is it interfering with my values? How is it interfering with my parenting? If I feel like I'm so anxious and on edge and constantly stressed about this, and the real question is, what if I didn't check? If you say, well, I can't check because if I didn't check 6 times, well, then something bad will happen. Then that's something that we need to look at. And it's important to figure out if changing those behaviors will actually help you feel less anxious in the long run. And that's an important thing, short-term versus long-term. If you tell people to reduce checking the monitor, that will maybe increase their anxiety in the short term because you're telling them to stop doing something.
Right.
But in the long run, you're actually being able to tolerate those anxiety and uncomfortable feelings. And you're letting yourself sit with those emotions, which is truly, truly so helpful with everything.
Okay, gotcha. And then can you expand on maybe you don't feel like you're connecting with the baby? Because I think that's another thing where there can be a normal measure of that, where we just need to take some bonding time. versus like, okay, it's been a while and I still like, I just want to hand them over to someone. And,
Yes.
and it's
Yeah.
not
So
just about being exhausted or,
yeah. So I like to say falling in love with a newborn is such a process. I mean, I will just use myself as an example. Like I
sure.
typically struggle from month 0 to 3. Now I have 2. So it's like I have more evidence that this is
Right.
true. And it takes me a while. And so I don't need to talk about my personal experience, but I think that you can't just expect that you're going to fall in love with your baby and it's just going to naturally happen and it's this magical thing. You may
Which
have to
it
put
does sometimes for some people, which then
yes.
makes us feel like if it doesn't, something's wrong.
Absolutely. So you may have to do things like you said, bonding. You may have to go in that corner and for 15 minutes read to the baby or look into the baby's eyes or do something to kind of increase that oxytocin and connection. Um, so I think that that's totally normal and I would not judge. And I think you have to accept that we don't all bond with our baby and that falling in love with the baby is a process. If and when you say, I really have tried all of these things. I've had enough sleep. I've had enough food. I've, doing these enjoyable things with my baby or, doing something special with them and still something is getting in the way, or I'm feeling like I'm really hating this, or I'm feeling like regretful that I even had this baby, then that's something to look at and explore and to talk through.
Yeah. And another form of anxiety, I think sometimes is not wanting anyone else to touch, help with, handle baby, right?
Yeah.
So a partner could be looking for like, hey, what can I do right now if there's like none of that?
Yes. Yes.
Yeah.
Yes, and that could be like linked to so many different themes. Perfectionism, for example. Let's say you want everything a certain way, and you know that your partner is now intervening and getting involved, and it's like, well, what if they don't put the sleep cycle on the right way? What if they put them to sleep at the wrong time? What if they didn't fill the bottle? To where
Yeah.
it needs to be. And so like perfectionism and its need for control can be a factor. So there's actually, you want to figure out what are the factors to consider too. Like if you're not handing your baby over because you're so scared something will go wrong when that person tries to help, that's one thing. If you're starting to have sadness or fears that they will like bond with someone else and feel attached to someone else, that's a whole other issue.
Right.
Or you could be someone who just really struggles to ask for help, right? So if
Yes.
someone is offering the help, but you're
Or
like, nope, nope,
accept
nope,
it.
accept it. Exactly. Like maybe you have this belief, I need to do it on my own, or a good mom is
Mhm.
always with their baby, right? So there's
Right.
like these beliefs that may need to be challenged and looked at. So
Yeah, because this is not a gig meant to be done alone.
yeah,
I experienced some sort of grief loss
yes,
surrounding like I didn't have a great pregnancy. I wouldn't say I loved every moment of it. But once he was no longer in there and he was here, I kind of missed, like, I felt like everywhere I went throughout the day, I had this little person in there that I would talk to, and he was just
yep,
mine alone.
yep,
And then it was different when he came out. And I did bond with him right away. And I was thrilled that he was here, but I kind of wanted both. I kind of
yeah,
wanted him to still be like just mine and come with me everywhere. Um, and I don't know what that was. I mean, it did obviously resolve as we went forward, but I just think it's the main theme of this is it can look like a lot of different things, and they're all anything can be normal, anything can be
totally,
treated and improved. It's not, it's not for forever.
totally.
um okay, and then so my next question, now we know kind of how it could present and how to tell the
Mhm.
difference of like, do we need to seek help?
Yeah,
You mentioned some thoughts that maybe people haven't heard of
yeah,
before, so I usually call those intrusive thoughts. Can you define
yeah,
what those are? What are some different kinds of
yes.
intrusive thoughts? Is that under the anxiety part of the umbrella?
Hmm. So anxiety and OC, so anxiety disorders, and what I mean by that is generalized anxiety disorder, social anxiety disorder, panic disorder, for example, used to be one and the same and under the same umbrella as OCD, obsessive compulsive disorder. Now they're actually separate. So I don't know if I have, this is the little book of disorders. It's called the
Yes.
DSM-5, and it lists all the criteria of these disorders. So OCD is actually separate now from anxiety.
Okay.
So again, not to always kind of follow the lead of like all the technical changes, I still see anxiety and OCD as a lot of overlap and it
Mhm.
could be treated similarly. There's like this core component of like fears and worries that lead to both anxiety and OCD. But the difference between OCD and anxiety is OCD, is composed of obsessions. So obsessions are intrusive thoughts that just kind of repeat, that cause a lot of distress, that we don't like, that kind of scare us, that don't make us feel good. And they're intrusive because they come back over and over again. They may take up a lot of our day. So that's the obsessive part. And the compulsion part is a ritual or a behavior that you do to get rid of the intrusive thought, to reduce the anxiety, to kind of quiet it. So you would think, we'll just use the typical hand washer, right? We have the obsessive thought, I don't want to get sick. I don't want to get sick. I don't want to get sick. What if I get sick? That's the intrusive, repetitive thought. The compulsion or the behavior or ritual is to wash your hands several times. And so that makes us feel better momentarily, instantly in the short term, but it actually creates more and more anxiety and like feeds the beast almost,
Right.
and makes it worse in the long run. So obsessions, compulsions, that's what makes OCD. And then anxiety is a little bit separate because you don't have to have obsessions and compulsions. You might have repetitive worry thoughts, but you might not necessarily have to engage in compulsions to get rid of those anxious thoughts.
Okay.
And it could just be general worries that take up space versus actual behaviors that you might be doing to get rid of the
Right.
anxiety.
So I think I have an example. So I wore my
Yes.
son a lot. He was like a very needy newborn. He was not ready to be here. So we did a lot of wearing. We did a lot of walking, get a change of scenery. And I would have this awful thing pop into my head that I was going to trip. And because he was on my front, I was going to smush him. Not to get too graphic, but it was very visual in my mind, like almost like a horror movie. So I didn't do anything to solve that. I didn't need to do any kind of compulsion, but those types of sort of gruesome thoughts would pop into my head, which made me feel like a crazy person. Because of course
Yes.
and some people even envision themselves doing like what if, I don't know, I'm not even going to give an example, but that was like an accident, but sometimes it can border on something more. So what's that?
Yes. So I want to say, and I'm an OCD specialist, so I've seen every thought under the sun, and I don't have any like fears saying a thought or sharing it with my
Right.
clients because I want them to feel that any crazy, I'm gonna, use
I
that.
was gonna say, like, what if I put my baby in the microwave instead of my
Yes.
coffee?
No, exactly. Like people have had thoughts. What if I just throw my baby over the railing? Like,
And
you know,
then
I
you're
have
like, oh my God.
right. And so that's a good thing, right? So it's like
Right.
having that reaction of like, I don't want to do that. So just to get a little technical, that's called ego dystonic, which means our thoughts and our urges are not in line with our values and what we want to do.
Because that's
So
confusing.
yeah, it's so confusing. It's like, I had a friend that said like, I always have this fear that I'm just going to like drown my baby. Like when I'm giving the baby a bath, and she's like, it makes me cry and I hate it. And I'm like, exactly, because that's OCD. That's an intrusive thought. You don't like it. You don't want to do that. You know, that's not reasonable. You know, that's not your goal. And so that's how we kind of see that as like, that's more of an OCD obsessive thought. Of course, we'd always want to assess if like you're actually having urges to do that to your baby. But most likely with OCD, you're not. You're actually really afraid of that thought and you hate it and you want to do anything for that thought to go away. So you might, and this is unhelpful, but makes a lot of sense, you might not give your baby a bath because you're so afraid of actually drowning the baby.
Like I was tempted to not walk or not wear.
Exactly, which would make
I don't think
sense.
I don't think I followed that through, but that temptation was there.
Of course. And 99.9% of people would say, yeah, don't give your bath a baby if you think you're going to drown the baby, but they don't know about OCD and how scary and also so normal it is to have just these thoughts pop in your mind that really you don't want to at all engage with.
Right. Okay. So we've thoroughly talked about what it can look like. Hopefully everything is very normalized. If a person, let's say I'm the mom, I'm hearing this and I'm like, okay, this is totally me and I didn't realize. This is another thing I didn't prep you for. Obviously they can reach out to you and we'll put your contact info in the show notes, but is there like a quick do this in the moment, here's your first step? And then I'd have the same question for like, what if it's the partner that's seeing it or the family member or doula, whoever?
Yeah.
What would they do first?
I think without getting so much into, because like OCD therapy and the evidence-based number one, treatment for OCD can be really hard to do and scary. However, it has amazing results and is so easily treatable. And like within 2 to 3 months, you will feel like OCD is not taking over your life. But the first thing I would want someone to just notice and acknowledge and accept that you're having this intrusive thought. Because once you can just label that this is an intrusive thought, you've already like have distance from it versus I'm having this thought that I'm going to push my baby. I'm a horrible mom. What's wrong with me? I shouldn't have a baby. I'm dangerous. So I think if you can just say, I'm having the intrusive thought that I'm going to drown my baby right now. this is just a thought, and I just
Yeah.
have to be aware that this thought is happening right now.
Because the stigma surrounding mental health in general, and particularly the type we're talking about today, comes from the secretiveness of it. So I know there's a campaign of like, speak the secret. So
Yeah.
the first step is to say it out loud. And then I would say for the partner or the person hearing that, you can say what they should do, but I would say don't freak out. don't stigma, like, I'm glad you told me, is something that would come to my mind of like, I'm so glad you felt comfortable telling me that. And then what would
Totally.
come next?
Yeah, so I think it's so important. So whenever I see someone for OCD, I always invite the partner, or I actually like require it, because
Yeah.
sometimes what happens is the partner is like reinforcing and actually making the OCD worse. They might say, "Yeah, don't bathe the baby because you're going to hurt the baby." And so it's really helpful for the partner to know how OCD works, what it looks like, and what to say and what not to say. So I think the validation is key. Like you said, like, "Hey, this is a distressing thought. I totally know this is really hard for you, and let's figure out like what's the next steps."
Yeah.
So maybe eventually the next steps is like, okay, let's bathe the baby together, and we're both going to be here, and let's do it for 3 minutes, right? Because let's say it's a severe case where they're really not bathing baby ever.
Right.
Let's see if we can bathe the baby for 3 minutes. And that's eventually where we need to get to, is like them not engaging in the avoidance behavior and letting them get to the point of, we're going to bathe the baby, and we're going to have to tolerate and sit through those uncomfortable, intrusive thoughts that may even come up throughout the bath.
Right. But that does often require professional support.
Oh,
We're not
yes.
suggesting that
No.
any layman attempt exposure therapy.
Exactly. So that is my plug. But I think the easiest thing you could do now is know that I wish people would talk more about their intrusive thoughts, because when I will just casually talk about it with moms, they're like, "Wait, I have intrusive thoughts. Wait, I have intrusive thoughts." And it's like, we all have intrusive thoughts.
Right.
And so I think like acknowledging that they're there and noticing and saying, this is like my OCD talking, like my OCD is bossing me around right now.
Yes. Yep.
It's just a good way to normalize it and to know that like it's not what you want to do, and it's uncomfortable and it's scary. And yeah, of course I wish you didn't have this thought, but you do, and you probably will continue to have the thought. And we need to figure out how to work around having these thoughts.
So let's say I'm a month in postpartum.
Yep.
You're my best friend. I'm not acting myself. You know all the flags. I'm not bringing anything to anyone's attention because whatever. I'm too embarrassed. I don't recognize what's going on. I'm so focused on my baby. What do you say to me that's not going to push me away? Like, that's always the hardest piece. Even when I work with clients in a professional role, if I feel like I'm the first one noticing, it's hard to say like, "Hey, I think you might need some support around this," because I need them to trust me for whatever we're dealing with, right? I don't want to push them away. So can you give us like a sentence or something?
Yeah. I mean, I think sentence, that's so much pressure. Things that I'd be thinking of is stating the facts and just like sharing what you're noticing. Because I think if you go into it and say, "Hey, you seem depressed," like probably not going to be so helpful or great, or it could push someone away. For someone else that could work, but it's like, "Hey, I've noticed that I haven't talked to you all week," right? That's just a fact. Or I've noticed that every time we talk, you're tearful on the phone. Or I noticed that you just said to me, "You're a terrible mom and you just want to sleep all day," right? It's like, I'm literally just stating what you said to me. And I think like there's two things, like problem solving versus just acceptance and validation. Like sometimes I'll say to a friend, "Do you need help problem solving this and figuring out how to change this and work through it? Or do you need just validation? Like, do you need me to just say, 'Hey, I know how hard it is right now, and I know how like miserable things feel.'" So like they can then say, "Okay, you know what? I actually do want help problem solving," which may encourage them to get more help. Or the validation is like, "I'm just hearing you, and I'm listening to you, and I'm just describing how you feel and what's going on for you. And I'm not trying to change anything or offer like tools. I'm just saying that I know how hard it is right now."
Okay. And we may not immediately say like, "Let's call somebody about this," or "Let's speak to the doctor about this." We might come to that later.
Yes. I think it's like, more of a conversation for sure. And it's difficult. It really is difficult. And someone might, say, "No, I don't need help," and like really just not want that help. And there's not much you can do.
But they may go through later and go like, "Oh," our initial reaction is not always our forever reaction.
Right.
And I guess this is a little out of order, but to go back to something, how is everything we are talking about different from postpartum psychosis? So I think the difference is, so far we've talked about actions like they're not going to act on them. They aren't going to actually harm the baby. It's not in line with our thinking. But there is a different level of this that we don't have to spend too much time on. But what's the difference, and how would we probably wouldn't know. That would probably take professional help.
Yes. Yeah. So postpartum psychosis is really tricky and more rare. So like one to two in 1,000 women. That's like the statistic that people often
Okay.
refer to. So 1 to 2 in about 1,000 women experience or people experience postpartum psychosis. And the biggest predictor of that is having a history of bipolar disorder. So that's something just to think about and know. Of course, it could still happen, but I think if you have any history of bipolar disorder in your family, that's something to think about more. So the difference between postpartum psychosis and postpartum or perinatal OCD, and this is like the most common question, is that with postpartum psychosis, you're experiencing things like hallucinations, delusions. You might hear voices telling you your baby's a demon, go do something harmful to them. And in those moments, someone with postpartum psychosis, it's more ego syntonic. So if you remember, ego dystonic
Mm-hmm.
is I'm having this thought, it's totally not in line with my values, and I'm freaked out by this thought. Ego syntonic, which is what happens with postpartum psychosis, is I'm having this belief it's not causing me a lot of like fear or distress, and I actually am likely to act on it. Like I'm in
You
this
might make a
calm
plan.
trance state, and it's like I'm thinking I need to do this, right? I'm hearing this voice, I'm having this delusion, tell me to kind of act on this thought. So that's why postpartum psychosis is truly a psychiatric emergency. And if you're feeling like that's happening at all, then that does require like immediate
Right. Which
hospitalization.
also means if your partner's coming to you and saying, "Hey, I had this crazy thought that's freaking me out,"
Yes.
you don't need to like immediately worry that like we're not talking about psychosis.
Totally. And people may believe that and think that if they don't have the knowledge, the psychoeducation, or if they feel like I've never had this thought and it's so scary to me, am I going crazy? Am I psychotic? Am I losing my
Yeah.
mind? So it is really important. And I think you do need to be meeting with, a mental health provider who's trained in these things so they can assess. Because
Mhm.
I think sometimes if you're not, trained in OCD work, you may think that that is a psychotic thought or something
Right.
like that.
Right.
So it's really important to know the difference. Is this person likely to act on it because it's kind of in line with what they're thinking? They're being told to do
Right.
this. They're convinced this is the right thing. Or are they like, I hate this thought. I don't want this thought. Oh my gosh, I never want to be this person that acts on this thought.
Right. And that's a good point. This is highly specialized, like any other specialty. So, yes, you can start with your primary physician, your OBGYN, your baby's pediatrician. However, they're not going to be, they need to then siphon you off to someone who can really take a look at it,
Totally.
because they don't have all the specialized
No.
training that you have.
Yeah.
Okay, so that was really important to say, and hopefully for everyone to hear. So far
Mhm.
we've talked about getting help in the moment after the fact, but I know, and you can tell us that particularly you mentioned a history, which is what brings me
Yes.
to this question. Even if you don't have a history, but particularly if you do, for example, I've been anxious my whole life. So I wish someone had told me like, hey, there's a really good chance that this massive life change and all the
Yes.
hormones are gonna make that worse. And you might want to set up some support in advance. The worst
Yes.
that happens is you don't end up needing it. The best that happens is we avoid like everything we just talked about and you've already got a plan. So what if a person does have a history or they just want to be really proactive? What are some things that an expecting person could do to prepare for
Yeah.
this possibility?
Yes. So I think the number one thing, of course, is therapy with the right provider, someone who specializes in perinatal mental health, maternal mental health, especially if you have a history. So you may have already been in therapy before, which a lot of people have been, which is great. But if you're someone who has an anxiety disorder, a trauma disorder, OCD, depression, anger issues, interpersonal problems, whatever it may be, it's really important to know that those things may increase and be exacerbated during pregnancy. And the good thing is for example, the OCD therapy, once you know how to do the work, you can apply that to any type of intrusive or obsessive thought. So before you have kids, you may not have anxiety about children, but
Right.
then, or obsessive thoughts about children. But then once you do, you can actually apply the same treatment to that. So that's good.
Mhm.
Um, but there's other things that you can always be kind of working on and checking in. And I like to call them vulnerability factors. So vulnerability factors would be anything that makes you more vulnerable to anxiety, stress, depression, anger, substances, whatever it may be. So
Mhm.
checking in on your physical, health, sleeping, eating, avoiding substances if necessary, because those things are just exacerbated and make it harder to function as a new parent.
Sure.
maybe it's checking in on all your relationships, right? And having the right social support and feeling like you have good friends in your corner or family or whoever that may be, people in the community. Not avoiding things. I think sometimes depression, anxiety causes us to avoid things. And so if we kind of start out by avoiding the things that we love and care about, that may make everything even harder.
Yeah.
Are
there certain personality types that have higher vulnerability, like type A?
Yeah, exactly.
Perfectionist.
That's what I mentioned before. So if you're someone who is, has perfectionistic tendencies, need for control, struggles with uncertainty. By the way, these are all like markers of anxiety, right? You know, if you struggle with uncertainty, having kids, life is uncertain no matter what. If you have kids or don't have kids, but like there's so much uncertainty with kids. There's a bug flying around, and that's gotta get away.
Today's episode mascot is
the bug. There's lots of flies in this household right now. So I think, if you're
because babies, newborns literally don't know the difference between night and day. There is no schedule. So if you're coming, especially the moms that I see have a hard time, or the parents, however we identify it, they're coming from maybe the corporate world. Everything's very scheduled. It's very like boom, 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 boom. And then we're home all day. No schedule. We can't talk at the water cooler. There's no adult conversation. Like everything just completely flips. So it's almost a double whammy of like the loss of all of that and then the newness of everything at the same time.
Totally. So if you're someone who, just has more of like a rigid personality style where you want things a certain way at certain times, if something shifts and changes kind of last minute, that's really hard for you to tolerate and like continue living your day, then that's something to really be on the lookout for, because, embracing uncertainty and embracing change and tolerating change and all of those things are so needed and helpful and such a good skill to learn before. And I think even communication skills, like I think like your relationship with your partner, if you have a partner, changes so much, when you have a baby, that like that could be something to work on before, being assertive, asking for help, saying
Everyone
no.
told me that and I was like, we're good. We're so good. Like we've been friends since we were teenagers. We're good. Guess what? We aren't currently together.
Right.
And I'm not laughing about it, but it's so far in my past. Like we're all okay now. But like I really wish I had paid more attention to that piece of it.
Yes.
And then
that would be something to work on. Just like communication and how you're going to communicate, especially when people are asking you for things or telling you things, or even saying no is such an important skill to.
And then trauma, past trauma, even if addressed, seemingly resolved, whether it be, we don't have to go down a litany of lists, but anything that could be triggered by the labor, the delivery, breastfeeding. So if there's sexual abuse in the past, there is a pretty decent risk, even if you aren't anticipating it, the body keeps the score, and something like that process could trigger an onset of symptoms.
Totally. So it's so important to just understand, like, what is your history with mental health? Like, are you someone who's experienced anxiety, trauma, OCD, body image, right? Eating concerns. I think that's a big thing for, people who are actually carrying the baby. That could be really tough. So if you had a history of body image, eating concerns, struggles with the relationship with food, that is something to address too.
And maybe you're in good shape at the start of your pregnancy, but I developed such bad carpal tunnel, which was a physical problem, that I didn't sleep for a huge portion of the third trimester. I would be sitting up on the couch because I couldn't lay flat. Couldn't sleep in that position. So I would watch the sunrise crying, like my chance to sleep is gone.
Yes.
So I was already exhausted before he arrived.
Right.
Then I insisted he stay with me at the hospital. So I didn't get any sleep in the hospital. I wouldn't let them take him to the nursery because I'm, control.
Of course.
So we were just set up for, now I do have a history of mental health challenges, but even if I hadn't, I think that sleep deprivation alone just set us up for a really challenging, scenario. So they would become something to think about really at any point.
Yes.
Okay. And then, so we know that this is very treatable. Mm-hmm. Does treatment always mean medication or a lifelong commitment to therapy? So I think that also holds people back from seeking support. Totally. And if they're breastfeeding, there's a lot of confusion. And I know you're not a psychiatrist, but well, I won't be able to be treated anyway. So touch on all that.
Totally. So because I'm a psychologist who doesn't prescribe medication, I'm always, and I'm using the word always, which is an extreme, but I'm always going to suggest that someone tries therapy.
Yeah.
I think therapy and medication is a great combo. And I'll tell you like who is a great candidate for that. So I think someone who maybe is having a hard time engaging in the therapy. So like OCD therapy could be very scary at first and
Right.
difficult and challenging. And so if someone's like, I'm unwilling to bathe my baby because I'm so afraid I'm going to drown the baby, I would say maybe we need to take a look at using medication to kind of lessen or damper the anxiety symptoms so that you can participate effectively in therapy, because there's really no point of doing therapy if you're not going to participate or be willing to
Right.
try something new. So I
Right.
think you can try something like CBT, which we can talk about, so like an evidence-based, tools-based, practical approach, and do medication at the same time, because medication could be so helpful. I think there's a lot of misconception that medication is going to cause harm and damage to the baby. And actually, untreated mental health disorders are way more damaging to the baby and yourself. So there's plenty of studies and research that really show very minimal risk by taking, a medication like SSRIs, antidepressants, anti-anxiety medication that could be life-changing for people. So
And I
I
do have a
definitely,
former episode with Dr. Brianna Dawson, who is a perinatal psychiatrist. So if anyone wants to hear more about that, go find that episode.
yeah, exactly. And so I think with the reason I love therapy, and I'm always making a plug for therapy, is because it gives you these lifelong tools and skills that you can access at all times. And you'll know what to do, and you'll know how to intervene. So I love that you have that knowledge and approach.
Yeah.
And you can get off the medication if therapy is really helping. You could always get on medication if you feel like therapy isn't enough. So I think the combo is really the best thing if needed. But some people really benefit from therapy and don't need the medication. And then some people say, you know what, I really need that boost. Or some people will just take medication and that will be great. And they don't want to participate in talk therapy. And
Right.
all options are fine, as long as you're really thinking about what's best for yourself or the baby and your long term.
Right. And therapy, I mean, look, I think every human would benefit from seeing a therapist every week to just process life in general,
Yeah.
right? Even no mental health concerns. However, it isn't intended to be indefinite. It's like targeted.
I want to
Let's
talk
do
about
some
that.
tools. Okay, so go ahead
Yeah.
and do that, and then tell us what are the kinds of therapies,
Yeah.
because there's so
Yeah.
many
So
acronyms out there.
so many acronyms. Yes. I could do like a whole podcast about each one, but I think that I personally am like a more present focused tools based therapist, and some people are not. So I focus so that doesn't mean we don't acknowledge the past. We don't figure out like where things come from and where they started and where these beliefs came from. However, we're really focusing on making your present better. Are we engaging in values? Are we doing the things that make us feel good? Are we engaged? Basically, are we living the life the way we want to live it? And what's getting in the way? So I'm forgetting. Oh, the question. Yes. I personally, when I do a consult with someone on the phone, I'm like, I don't want you to be in therapy forever. If you are in therapy forever, that's fine and that's great. But like, my job is to give you all the tools and skills so that you can be your own therapist, and you can
You
almost
should be
say,
working yourself out of a job, right?
exactly. Like, I don't want you to feel like you need to come here each week. I want you to be like, okay, it's when, I meet with someone once a week for 45, 50 minutes, but
Yeah.
most of life happens out of our therapy session. So I want you to be like, okay, it's Wednesday, 1 p.m. I'm feeling really stressed. I'm feeling really angry. I'm feeling sad. What are the things that Michelle has given me to feel like I can get through this situation?
Right.
So I personally don't think that therapy needs to be lifelong if you're using therapy effectively, if this treatment approach works for you. By the way, some of these therapies may not work for you, and you may need to be, and it really depends on the presenting issue too. But my job is to hear an issue, give you some tools to solve it. It's not that easy. It's more complicated. And then feel confident that you can kind of be your own therapist. And I always have people say, thank you. Like, I feel good on my own to solve these problems. So I guess I could just talk about, cognitive behavior therapy. There's a lot of therapies within cognitive behavior therapy. So cognitive behavior therapy in a nutshell is
Which we
like
call CBT often.
CBT. Yep. CBT is a time limited therapy because it does give you tools and skills that you may need in the moment. And no matter what comes up, you can utilize these approaches with those problems. And we're really looking at, what are my thoughts? So we talk a lot about thinking patterns. So let's say you're at the park and you see a mom that's playing with her baby. And you have the thought, oh my God, look at that mom and look at that baby. They're so happy. I'll never be happy. Okay. So that's the thought. You might have an emotion or a feeling that's like sad, right? I'm just using that example. And then the behavior may be that you walk away feeling really hopeless, defeated, and then you're kind of sad for the rest of the day. So we're really trying to link, like, what are my thoughts? What am I thinking? How does that influence my feelings? And then how does it ultimately influence the behaviors that I do? So we talk a lot about feelings, thoughts, and behaviors that you're engaging in that are either helping your mental health or not helping so much. And then, so within CBT, there's EXRP, which is exposure and response prevention, which is what we were talking about for OCD.
Right.
You're
Can you
really
bathe the baby for
tackling
3 minutes?
yeah, exactly. So you're really trying to target and figure out what are my obsessions, what are my compulsions, and what do I need to do to reduce the level of OCD and anxiety so that I can live my life more effectively. So that
Okay.
will mean that you are doing some exposures. You're basically doing like the opposite of what your OCD is telling you to do, which is at first really scary, and then it's super freeing because you're not feeling like you're giving into this beast of OCD that's actually making your anxiety and OCD worse.
Got it.
And then separately, but not separately, because DBT is a form of cognitive behavioral therapy, but it's my favorite therapy. And what I love about DBT that's a little bit different is it gives you tools and skills in different areas. There's different modules. So I'll just talk about them quickly. Emotion regulation. So how do we regulate our emotions? How do we not act on our emotions impulsively? How do we manage our emotions so that they don't take over? We don't feel like our emotions are so powerful. Distress tolerance. So when I feel like I'm going to make a situation worse by acting impulsively and doing something that I may regret, how do I not do that? Mindfulness. So how do we attend to the present moment, live our life effectively given what's happening to us right now, not what's going to happen in the future, not what's bothering us from the past. How do I practice mindfulness? Interpersonal effectiveness, which is all about how do I communicate with people? How do I say no? How do I ask for things I want? How do I be mindful of other people and their experiences? Basically, how can I be effective in interpersonal relationships?
Right.
And so DBT gives you all of these tools from all of these different modules for distressed parents who are having trouble regulating emotions, trouble asking for what they want, asking for help, feeling like they're not present or mindful or attending to the things that are important to us right now.
Yeah.
So there's lots more I can say about that, but
Yeah, sure. And I think something just popped into my head while you were talking. Like, what other job would we get thrust into with zero training and maybe little to no preparation, no instructions, and not need someone to sit with us and give us a tool set for this job, right? Like we'd be like, that's ridiculous.
Right. And I thank you because you've helped me with my baby's sleep. By the way, like
we
I
can't
know
specialize in everything.
exactly, but I know that I'm really vulnerable when I don't sleep, and like that's what increases my mental health problems. So I came to you, the expert in sleep, and so there's also just like what else can you do? Like if you can like work with someone who knows what they're doing about the problems that you're experiencing. And trust that and follow their lead and like be willing to try difficult things because it could greatly help you and your mental health and everything.
Yeah. And sometimes these types of symptoms are brought on by not enough sleep, not enough nutrition, not enough help, but it isn't really a diagnosable thing that needs to be treated. We just need someone to help us focus, or we need to refocus on our like basic human emotions, or basic human needs, not emotions. So that's, important to say too. And thank you for the shout out. Yes, I help with sleep. I rarely talk about what I do, but I help parents sleep.
I'm changed forever because of you. So how could I not give you
I have one last question for you in a moment. It's a personal question, but I actually thought of something else. So you mentioned that we're talking about up through the first year after delivering. This is more for my own personal information. Let's say that no one noticed I had anything going on for the first year because I'm a perfectionist and I mask and I think I can handle it myself. And so I don't get treatment and I don't get help. Nothing magical happens at that year mark. So are you saying we just wouldn't call it the same thing anymore?
Yeah.
Like all the symptoms could still be present. You could still need the same support. It's just at that point, it's something else because it's so far out.
Right. This is just my personality and the way I see things. There's never like a time limit, right? Like, and it's going to follow you because I also have my anxiety issues and certain things that I struggle with. And like, no matter how old your baby is, they're going to be present and they're going to be there.
Because I don't want somebody to hear this and be like, well, I had my kid 2 years ago. So clearly that's not. But if it's left unaddressed, it's still there.
Totally. And it's like your every stage has its anxieties. It's like, okay, now they're 2 and they're maybe starting to walk and talk and all those things. And it's like, wait, I'm having anxiety still about A, B, and C. So I think it's going to kind of follow you no matter what, because your baby or your child or toddler, young adult is always going to be changing and potentially putting you in a difficult situation to embrace that change and to roll with the change. So I think whenever you're experiencing anything at any time period of any point of your child's life is a good time to address it.
Beautiful. Okay. So take your professional hat off.
Yes.
Put your mom hat on only.
Yeah.
What is one thing that you have learned on your own parenting journey that we did not talk about yet, that you discovered somewhere along the way and you were like, man,
Yes.
I wish I knew that sooner and I want everybody to hear it now.
Yes. Yes. So I actually really wanted to ask or talk more about this when you mentioned grief, because grief, people think is like there was a real loss or someone died. Well, it is a real loss, but someone died or I don't have this person anymore. But grief, I experience a lot
It's
of
a
grief.
tangible loss.
Exactly. Grief to me is like you're kind of losing self, time, relationship with your partner, just like change in your routine. And that's something I really struggled with. I am also more of like a type A person. I like to work out this time. I like to eat this meal. I like to do this, this, and this and accomplish in my day. I like to do my work at night, or this is what my morning looks like. And everything kind of changes in that way. And so this is a plug also for DBT, because DBT talks a lot about like two things can be true at the same time. So you could feel really sad about kind of losing some of those routines or changing those routine, and sad that some of those things will have to kind of change forever to some degree. And you could be really grateful and in love with your baby and so happy that this is what is your life and what's happening. But I think obviously a lot of people talk about this, like you judge yourself for feeling sad or annoyed or irritated. Like I can't do my workout because my baby's awake. And like I've tried doing my workout while my baby is awake and it didn't really work out. So I think that that's totally normal and fine. And it's okay to feel like I'm sad that certain things don't exist, or I can't have that time with my friends, or my relationship with my
another
partner.
thing that we should be able to speak out loud. And I feel like partners hit this even harder sometimes. And then there can be contention over like, but we both wanted this. We agreed to do this. Like, what's your problem? But, you could be like, hey, that body used to kind of be more for me. I'm losing your attention. And yes, I love that it's going to the baby. And we don't have the same, dynamic, same time that we had before. It's valid to grieve that. Look, I grieved the loss of breastfeeding and co-sleeping, even though I was completely done with both of them. They were not working for us. It was like a disaster. And yet I still had to say, like, I'm sad that's done. It wasn't serving us well anymore. So it needs to be done. That doesn't mean I'm like, yay, he's not in my bed anymore.
Totally.
I grieved that and slept with a pillow.
Exactly. There you go. Yes. And I think that's also like, it could be something you want to do. And at the same time, if it's not working for you and it's causing more distress, like you may have to make a change.
Yeah.
And I think like just on that, another thing that I learned as a parent we didn't talk about is just the rules that you make. Like if you've made a rule, like I want to breastfeed for 4 months and it's 2.5 months and you're like, this is miserable, this is exhausting, it's not working, it's causing more pain, I'm annoyed. Yes. Then you need to really check in with yourself and ask yourself, why do I have this rule? Why am I following this rule? Is it serving me? Is this because I'm comparing to someone on social media that shows how much they pump in a bottle? And it's like, I think like social media comparison and all of that's a whole other topic, but that's something to think about too. You see someone who struggled with really connecting with their baby at first, seeing someone posting a picture of their baby and connecting. It's like, you really don't know what's going on with that person. It's really hard to judge. We're probably making assumptions, and comparing is probably not going to make us feel any better. So just trusting like you are where you are and being effective with your own family and your own situation versus this person did this, it worked for them. Bringing it back to yourself, your own kind of gut and wise mind and all of that.
Yeah. And we're all therapied up in our house. We each have an individual therapist. We have couples therapists. We have family therapists.
Yes.
Truly a work in progress. But we are big fans of using the two things can be true. And we've gotten out of the habit of but, because but kind of negates everything you just like. I love my baby, but I'm really sad. It's so much more useful and it feels so much more positive to do the and. I love my baby and I don't love every minute of parenting.
Yes, I love that. Because
it makes it okay.
It makes it okay. And like two opposite and very conflicting emotions and thinking could exist at the same time, which just makes so much space for both things.
Which we all understand in a different context. Like I love my partner and he knows how to push my buttons and get under my skin like nobody. Sometimes I don't like him, right?
Oh my God, of course.
We all know that that's true. So if we can just apply that to, our babies in this experience, it would be, I think we'd all have an easier time if we could have more honest conversations on the topic and let everybody know that, all of this is common and normal and okay.
Totally.
And thank you for bringing attention to the grief because I experienced that as well.
Yes.
Awesome. This was so, so helpful. I'm
Good.
sure that I will have you back again because there's so much,
Yes.
like you said, that we could dig
Yeah.
into. I will, of course, let everyone know where to find Dr. Litwer in the show
Yeah.
notes. Thank you so much for joining me. Listeners, I hope this was helpful. I'll be back soon with more stuff that I and others wish that we knew sooner and want you to know now. In the meantime, I'll leave you with my current list of stuff I learned the hardest way. Your to-do list will always be there, so put yourself somewhere on it, ideally at the top, especially if you're in this tough period where we tend to get pushed to the bottom. You can't pour from an empty cup, which is so tempting when you have a new baby or several children who need your attention. You just like, I'll feed myself later, and then you're ready to pass out because you haven't had anything, right? So refill your cup so that you can pour out to your baby, your partner, everybody else. And finally, there's no way to be a perfect parent. I say that as a recovering work in progress perfectionist. Countless ways to be a really good one, and taking care of your own mental health is definitely key for that. So keep those things in mind, and we will be back soon with more great stuff for you. Thanks for listening, everyone. Thank you, Dr. Litwer.
Thank you, Erica. So good to see you. Bye.